Hi, I'm Kylie, and I am a registered nurse and a nurse educator in a hospital. And this video is about reuse of surgical masks and N95 respirators in the healthcare setting. The video is intended to share evidence with healthcare workers on the safety of mask reuse, as well as the CDC's recommended protocols for reuse. So, historically, mask reuse is something that those of us in healthcare settings have been told not to do. For me personally, I actually teach staff about PPE and tell them that masks are single use. Never reuse masks, even if it's with the same patient. But now that we are at this crisis level shortage of PPE and COVID 19 still seems to be ramping up here in the United States, there is a high likelihood that we will be reusing masks if your organization isn't already. And I know that many people, including me, are worried about the safety of that. So I wanted to do a lit review and hopefully put my mind at ease. And I also wanted to be able to speak to the research if I do have to teach people how to safely reuse masks. So, first, I'm going to talk a little bit about types of masks. N95 respirators are a type of mask that has a filter and it seals very tightly to the face. And it prevents tiny air particles and pathogens from being inhaled by the person that's wearing the mask. Surgical masks are looser fitting and they don't protect against airborne pathogens as well, but they do really great in protecting from larger droplet-borne pathogens or fluid splashes. The CDC actually says that extended use and reuse of either of these masks is okay during critical shortages like we're experiencing right now. So, just to define a little bit, extended use means wearing the same mask for repeated close contact with several patients without removing the mask between patients. So, that would be something like multiple patients infected with the same pathogen being placed together in the same area so that the healthcare provider doesn't have to leave the area while wearing the mask. So, that might make sense in like an emergency department or a clinic waiting area or something like that. Reuse means using the same mask for multiple encounters with a single patient, but doffing or removing the mask after each encounter. So, this would be more likely the scenario if you do work with patients in an acute care hospital. So, I'm going to focus on reuse during this video because, according to the experts, there is a much higher risk of cross contamination with that repeated removal and reapplication of the same mask. So, COVID 19 in most cases is a droplet borne illness, meaning the virus is present in larger moisture droplets. And those droplets are actually still very small. You can't see them, but they're large enough that they can land on and contaminate surfaces within about 3 feet of the infected person when that person coughs or sneezes or forcefully exhales in some way, like if they laughed or something like that. So anything within about 3 feet of the person can become contaminated when those droplets land on it. So surgical masks can protect the wearer from breathing in those droplet particles because the droplets are too large to penetrate the mask, but the droplets can land on the outside of the mask and contaminate that outer surface of the mask. And so that's one reason why typically surgical masks are not intended to be reused for more than one encounter with a patient, because that outside surface is going to be contaminated, and repeatedly touching the mask to take it off and reapply it is risky in regards to cross-contamination. Also, with repeated use, if the mask gets too moist from the wearer's breathing, it can become less effective. As far as reuse of N95s, that's actually a common practice because typically N95s historically are used for strictly airborne illnesses like tuberculosis, where those fomites are not so much of an issue. So airborne illnesses stay floating around in the air and they don't land on anything and contaminate it. Right now, because of the critical shortage of PPE and masks, Many organizations are asking staff to reuse both N95s and surgical masks. So first I want to say, as far as reuse, that all the research I found about reuse of surgical masks basically says not to reuse single-use masks unless the only other option is no mask at all. But these are desperate times. If your organization is asking you to reuse a mask, it's not because they want to put you at risk. It's because reusing the mask is the less risky alternative compared to no mask at all. Because right now, frankly, the world is running out of masks. So for reuse, guidelines for reuse, the CDC first and foremost recommends that facilities, organizations, healthcare organizations have clear policies and protocols about reuse and that they educate staff on those protocols. They make those protocols and policies easily accessible, front and center to the staff who are having to reuse the PPE. Also, it's important to retrain staff on proper donning and doffing of PPE and teach staff to use that critical thinking and that mindfulness in the moment so they can think, okay, where did my hand just touch? Should I wash my hands now? It's probably also a good idea to review proper hand hygiene. We all think we're the best at washing our hands, but COVID-19 has proven that we're not that good at it. So we do need to be reviewing hand hygiene as well. All the studies I reviewed, along with the CDC and the World Health Organization, recommend that if you do have to reuse a mask, excellent hand hygiene for the full 20 seconds, both before and after mask removal, and regardless of whether you have gloves on or not, is extremely important to prevent cross-contamination after touching the surface of a contaminated mask. Several studies measured viral contamination on masks after being used on patients with the virus. I think most of them were flu viruses, and they showed that masks do get contaminated on the outside even if they look perfectly okay. A study by Redman and colleagues found that if they're using a mask, nurses touch their face or the mask an average of 25 times a shift to make adjustments to the mask. So if the mask is contaminated and we're touching it on average twice an hour, this could cause major cross-contamination if we don't do excellent hand hygiene. So the key is that if you do touch the mask, whether it's with a glove on or with your bare hand, perform hand hygiene before and after you touch the mask. Don't touch the mask and then spread those germs around the rest of the hospital. Also, when you take off a mask, remove it by the ear loops or the ties, not the front of the mask. So you don't risk contaminating your hands from the mask or contaminating the mask from touching it with your unclean hands. If you do have to touch the mask, however, in order to store it, perform hand hygiene again before and after touching the mask, even if you're wearing gloves when you're touching it. Also, you can prevent contamination of the mask altogether by covering it with a face shield or some other protective layer, like using a homemade mask that many people are so generously spending their time to make and donate to healthcare organizations. So if you put that homemade mask over the top of a medical grade mask, that can protect the medical mask from contamination. I personally am a big fan of the plastic face shields that cover down to below the chin and around the entire sides of the cheeks, because those can easily be cleaned. They're plastic and they can easily be cleaned with disinfecting wipes multiple times throughout a shift and reused very easily that way. As far as storage is concerned, the CDC says that for surgical mask storage, you need to fold the mask in half with the outer surface touching. So the mask is on, when you take it off, fold it so that the outsides touch, and place it in an air permeable container or air permeable bag so that it can start to dry out in between wears. N95s should be stored similarly, but don't fold them, because if they get compressed or misshapen in any way, they're not going to be fully effective against those airborne particles. One caveat for N95s, the World Health Organization and the CDC say definitely do not reuse those N95s that are worn in close proximity to the patient during those aerosol generating procedures. So according to the World Health Organization, aerosolizing procedures would be tracheal intubation, non-invasive ventilation like a BiPAP, or manually bagging a patient during a tracheotomy procedure, during CPR or bronchoscopy, or even during neb treatments. So a bit of evidence that supports that is a lit review from Fisher and colleagues that showed that in cases of influenza type illnesses, those aerosolizing procedures significantly increase the potential for pathogens to contaminate that N95 mask, even more so, surprisingly, I thought, even more so than droplet spray from a direct cough or sneeze onto the mask. The good news there, as far as preserving N95s, is that there is a potential opportunity to conserve N95s used during those aerosolizing procedures by decontaminating the masks using UV light to kill the virus. So there are specific UV lights made for hospital use, and hospitals usually have them to decon rooms after certain types of illnesses that patients have. And research shows that those lights can also be used to decontaminate some PPE items like N95 masks. So hopefully N95 mask manufacturers specify whether their masks can be decontaminated with UV light, and hopefully they're also saying how many times the masks can be decontaminated and still maintain their high quality filtering properties. So that is what I've got for you. I hope you found this video helpful. I hope that if your organization is instituting mask reuse strategies, that this video and this research helps put your mind at ease a little bit, or get you thinking about some suggestions you can make to enhance the strategies at your facility around mask reuse. Most of all, though, please stay well, stay safe, take care of you, and most of all, thank you, healthcare providers, for all that you're doing and all that you're sacrificing during this time to help patients get well and stay well.